All right, so what is the epidemiology of carotid stenosis? So interestingly enough, about 8 to 15% of ischemic strokes are attributed to atherosclerosis of the carotid artery. Back in Lancet in 2014, there actually is a really interesting article that showed that actually whole body scans of mummies and pre-industrialized hunter-gatherers with well-preserved cadavers had evidence of atherosclerosis in about, I don't have it on here, about 30% of the general population even back then. So this is something that predates our current eating habits and food preparation, some would say excesses. It's certainly something that's been with us for a long time. One current study showed that about a third of individuals that had never had any symptoms between ages of 40 and 54 years had ultrasonographic evidence of atherosclerosis in the carotids. So that's roughly your prevalence, like right in the middle years of 40 to 54. About a third of people have some degree of carotid atherosclerosis, which is pretty prevalent. So obviously we have some basic carotid anatomy here. So the carotid artery is a paired cervical arteries. There's one on the left and one on the right, obviously. And its job is to irrigate the anterior circulation of the brain. So just to start off with some basic anatomy, roughly normal anatomy, and how do the carotid arteries arise. So I will try to quiz the audience. I don't know if that's going to be successful or not. Let's see here. Maybe not. I don't see any way to see answers. But so you have your aortic arch here. If anybody just think in your own mind, what is this artery here? The first branch. So that would be your innominate or your brachiocephalic artery. It provides the supply to the right arm, as well as the right carotid artery and right vertebral artery and shoulder. This first branch is the common carotid, subclavian. And then up here, the next order of divisions would be internal carotid artery that traverses to the brain, and then external carotid arteries, which branch in various patterns. Maybe it may be flipped here, actually. Yeah, maybe this is external here and the internal here, and same thing here. And then over here, you can actually see this is considered a normal anatomy. You actually see a little bit of atherosclerotic disease here on this patient's left internal carotid. This is what a carotid bifurcation looks like on an angiogram. So we're looking at a roughly AP, but a little bit of an oblique angle. You can see someone's teeth here. The nose is probably just up the screen here, the lower portion of the jaw, cervical spine. And this is an injection into the common carotid artery, and then the division into the internal carotid, which traverses up through the petrous bone to the skull and into the brain. And then the external carotid artery and a series of branches, which are named and we won't go into here, but are interesting fodder for medical student questions. So the major branches, the internal carotid artery, this is an anterior view here. And this is unique in that you can actually see both carotids going to the brain and both sides of the anterior circulation at the same time via someone that had a carotid occlusion and they injected. We were able to push dye through the entire anterior circulation when they injected via this tip of this catheter here. The major branches are the ophthalmic artery, which supplies blood flow to the eye and the intraocular structures. Very commonly have a posterior communicating artery is next. These are all intracranial vessels. There's some extracranial vessels as well that aren't covered here. The next branch up is the superior hypophyseal artery, and then the anterior cerebral artery, which is here, and then the middle cerebral artery, and that's your basic anatomy of the intracranial arteries.
Hey everyone, Ryan Rad here from neurosurgerytraining.org. If you like that video, subscribe and donate to keep our content available for medical students across the world.